Hi, and welcome back. My name is Robert. I'm a registered nurse, and this is a continuation on how to create a detailed list of your loved one's medications and how to help manage in a home environment. To start to put together your loved one's medication list, I would recommend to have a few sheets of typing paper available since it might take several times to get it the way you actually want it to look. At the top of the sheet, centering this, write medication list. Underneath that, and you can center this too, write your loved one's full name. If they're Mr., Miss, or Mrs., or use a different prefix, a choice can be is to place it before their first name and following their last name if relevant, such as senior, junior, or third, or other known suffix. Consider to place this as well. If they don't go by their surname, but rather a preferred name or nickname, for example, his name is Charles, but he goes by Charlie, or her name is Elizabeth, but she goes by Beth, or he goes by Red due to his red hair. On the next line, place in parentheses, write the word preferred name or nickname, followed by a colon, and the name chosen. Here are two examples. The reason you're including this is that if your loved one's medication list is to be reviewed by a medical staff member, your loved one may be more receptive and trusting of that person if they're referred to by the name they're used to being called rather than their surname. Next, going downward along the left side of the sheet, write the word male or female, and to the right of that, draw a small stick figure, the kind you would see outside a restaurant bathroom, one that represents their gender, thereby further emphasizing for first names can be interchangeable. To the right of that, write the word height followed by a colon and their current height, and next to that the word weight followed by a colon and their current weight. To indicate height, used in this example, your loved one is 5'4". So you would write the number 5 followed by the word foot, and then the number 4 followed by the word inches. I wouldn't recommend using the quotation marks. That could be misunderstood. But next to the number 5, you could write FT period to indicate foot. And next to that, the number 4, write IN period to indicate inches. If so desired, you can even write this in centimeters, which is roughly 162. So you would write 162 centimeters or use the centimeters abbreviation, which is cm period. For weight, for example, if there are 154 pounds, you would write the number 154 followed by the word pounds, or the abbreviation for pounds, which is lbs period. You could also write this in kilograms, which is roughly 70. So you would write 70 kilograms, or write the kilograms abbreviation, which is kg period. One particular reason for this is that the strength of certain prescribed medications can be determined by a person's height and weight. And if your loved one was to be seen in the emergency department of a hospital, this could help those doctors and hospital pharmacists have a clearer understanding of what your loved one's prior medications were based off of. Underneath this, write date of birth followed by a colon. Spell out the whole month followed by the 2-digit day and the 4-digit year. After that, write telephone number or cell number followed by a colon, and the number your loved one can be reached at. Next, write home address or current address followed by a colon and their complete address. Continuing down the left-hand side, write contact person followed by a colon. If you're the contact person, write your full name, and next to it or underneath in parentheses, write your relationship to your loved one, such as a daughter, son, daughter-in-law, son-in-law, etc., followed by your telephone number. If there is more than one contact person, consider to list them as well. Just repeat the process. Below that, write primary doctor followed by a colon. Write the doctor's full name, title, and telephone number. Then the word pharmacy followed by a colon, their name, address, and pharmacy telephone number. And lastly, as per these suggestions, write the word allergies followed by a colon. If your loved one has no allergies to medications or food, write no known allergies. If they have allergies to certain medications, foods, or other items, list those particulars. At this time, again, we're going to take a small break, so please stay tuned.